Hi, Kelly.
Hi.
Hi, my name is Catherine Howard. I'm your student nurse practitioner. I'm going to be performing a head-to-toe assessment on you.
Okay.
I'm going to be looking at your head, your eyes, your ears, your nose, your throat, and your mouth. And then also looking at your cardiovascular and respiratory system, so your heart and lungs.
Okay.
I'm going to first do hand hygiene. Throughout the test, I may have you change positions, but I'll try to minimize that. But if you're ever uncomfortable, please let me know. I did provide for privacy. We're in a private room, but if you ever feel uncomfortable, again, just let me know.
Okay.
And we will go ahead and get started. So I'm first going to inspect your head. Everything looks pretty symmetrical. And then your hair is evenly distributed on your scalp. And then I'm going to go ahead and move to your eyes. Your eyebrows are evenly distributed. Your eyelashes are also evenly distributed going out. I'm just going to pull down and look at your conjunctiva. Nice and white. Okay. Do you have any vision problems? Have you had any problems with your eyes? Okay, your pupil's about 4 millimeters, equal bilaterally, round. We're first going to be doing a vision test. So what I'll have you do is I'll have you actually put a hand over one of your eyes, and I'll have you hold this about 14 inches from your face. And go ahead and try to read this bottom line for me.
Okay. 3729446 WM3X003
Okay, perfect. Let's try the other eye. And that same line again for me.
3724846 WM3X003 1+.
Okay, so you just missed one on each. It was actually, that fourth one was actually 6.
Okay.
But that's okay. You can miss up to 2. You have 20/20 vision.
Okay.
So now we're going to go ahead and test just your eye movement. So if you'll just keep your head still, and I want you to take your eyes and follow my finger, okay? Good. Your eyes are moving very symmetrical and equal. It's what's normal. I don't see any signs of nice stagnus where your eyes shake. So now we're also going to check your peripheral. We'll check your peripheral vision. If you'll cover this eye for me with that hand, and I'll do the same. And I want you to let me know when you see my fingers come in.
Okay.
Okay? Ready?
Now. Now. Now.
Okay. And then we'll do the same for this eye. Ready?
Now. Now.
Okay. And I saw it. My fingers come in at the same time you did, so we
Okay.
have equal peripheral vision, which is normal. Now we're going to check for convergence. If you could just focus on a spot on that wall. Okay, focus really hard. Now focus on my finger. Good. Now back on the wall. Okay, good. You have good convergence. Your eyes constricted and moved in to focus on my finger, so that's good. So now I am going to test if your pupils constrict or not, which is normal. So what I'm going to place my hand here, and you just keep looking for it. You can look at me. I'm going to shine a bright light in your eye. Okay, your pupil constricts. Now I'm going to look at your other pupil, and that also constricts, which is normal. We're going to do the same for this eye. Ready? Okay, that constricts. Now I'm going to look at the other pupil. Very good. Okay. And so now that I've tested your eyes, I'm going to go ahead and actually look in, and I can visualize your optic disc in your macula. Okay. Okay. So I'm going to just touch your forehead, and I'm going to get really close to you, but if you feel uncomfortable, please let me know. I'm going to first test for to see if you have the red reflex, like in a camera, and then I'm just going to visualize inside, okay? If you just want to focus at a spot on the wall and just keep looking for it, I might come into your your eyesight, so just keep it there, okay? Okay. You doing okay?
Mm-hmm.
All right. I'm going to do the same for this eye, okay?
Okay.
Just keep looking straight. Okay, perfect. I was able to see in both eyes your optic disc. It's like a little yellow, pinkish round closer to your nose, and then I was able to see your macula, which was a little darker. It might have made your tear up at the end, but everything was normal. So now I'm going to move on to your ears. And so I'm going to just tuck your hair back. And your ears, they look symmetrical. Any tenderness at all? How about when I push on the tragus?
No.
Anything? Okay. So now before I actually inspect your ears, I'm going to do a couple hearing tests.
Okay.
So if you will take this hand and include that ear and kind of wiggle it in a circle, I'm going to stand 2 feet behind you and say some numbers, and I just want you to repeat what I say, okay? 517.
517.
Perfect. Now if you want to include this ear and rub it in a circle, now stand 2 feet. 372.
372.
Perfect. Okay, and now I will go ahead and do a Weber test, and I want you to let me know if you can hear the sound equally or better on one side.
Both sides.
Okay, perfect. So now I'm going to do the same back here, and I just want you to let me know when you cannot hear the sound anymore.
Okay.
Okay?
Okay, now. Okay, now.
Okay, perfect. It took twice as long. This was bone connection, and the other was air connection. And air connection, it travels twice as long, so that was normal. We'll do the same for this side.
Okay, now. Okay, now.
Okay, perfect. About the same. Twice as long, so that is a normal finding. Okay, and let me know if I hurt you or if I go in too far.
Okay.
Okay, I'm just gonna pull back, and then I'm gonna inspect your ear canal as I insert. Okay. A little bit of earwax in there, but I was able to see your tympanic membrane. It's a pearly gray, which is a normal finding. It's round and there's no bulging or redness. I'm going to do the same for this ear. Okay, same for that. I saw a pearly gray tympanic membrane, no redness or bulging, which is normal. So now I'm going to move on to your nose. Okay, it's pretty symmetrical. What about your sinuses? Do you have any pressure?
Mm-mm.
Okay. What about?
No.
Okay. And then I am just going to actually kind of pull up on your nose. Okay, can you occlude one nostril? Can you breathe out the other? Good. Let's try the other one. Okay, perfect. I'm just going to take a look inside. I won't touch it. Okay, your turbinates are red and pink. Looks normal. Okay, so now let's move on to your mouth. Can you smile really big for me? Perfect. Now open your mouth. Can you puff out your cheeks? Perfect. What I'm going to have you do is, can you stick out your tongue for me real wide? I'm going to just use this tongue blade and just visualize your, okay, can you say ah? Perfect. Let's try that one more time. Okay. Everything looks normal. Your tonsils are 1+. I'm also going to, can you open your mouth one more time? Look at the side of your oral, of your cheeks. Your oral mucosa looks nice and pink. Under your tongue, perfect. Looks nice and pink. There's no lesions. Roof of your mouth, still nice and pink. Yeah, no lesions. Your tongue looks good. Your lips look good, symmetrical pink. No dryness or cracking. So now I'm going to do your just your neck. Can you extend your head up for me? Can you swallow? Perfect. Okay. And now I'm going to actually palpate your thyroid gland from behind, okay?
Okay.
Okay. Okay, so there's the front of it. I'm just going to displace it to one side. It's easily movable. Same for the other side. Can you go ahead and swallow for me? Perfect. It moved up and down evenly and equally. So that's good. Now I'm going to do your lymph nodes. So you have your pre-auricular, your post-auricular, your occipital, your submental, your submandibular, tonsillar, cervical, your deep cervical, posterior cervical, and your supraclavicular. Any tenderness?
Mm-mm.
Okay, perfect. So now I'm going to go ahead and move on. I'll go ahead and do your cardio, listen to your heart sounds while you're sitting up for me, and then I'll listen to your breath sounds, and then I'll have you turn around, okay? So first off, I'll go ahead and listen. So while I'm doing that, I'm inspecting the skin of the thorax and the chest, and your skin looks very, very normal. Looks, the integrity is there. There's no lesions or rashes or scrapes or anything. So I'm going to go ahead and find your angle of Louis. That's the second intercostal space. Okay, so this is your aortic sound. It's your second intercostal space, right sternal border. Okay, that's where S2 is heard the loudest. I'll go over and do your pulmonic. It's your left second intercostal space, left sternal border. Perfect. I'll move down to the third intercostal space, left sternal border. That's Erb's point, or the second pulmonic. Okay, I'm just going to touch you, okay, just a second. Okay, I'm going to go to the fifth intercostal space. I'm just going to lift up your bra here. Okay, this is your tricuspid. Okay, and then I'm going to do your mitral area. I'm going to lift up your bra again, okay? And this is the apex of your heart, so your S1 is heard the loudest. Okay, and then I'm going to listen to all those with the bell of my stethoscope as well. Moving down to the fifth intercostal space. Okay. Okay. And since you're sitting, I would also have you lay down, and I would also listen to the exact same points again, but just for the purpose of this exam, I'll just listen to you sitting up. And speaking of that, I'm going to go ahead and palpate the carotid arteries and go ahead and listen for bruits. Bruise. I'm just going to do one at a time. Okay, nice and strong. Okay, and what I'm going to have you do is take a deep breath and hold it, okay? Perfect. So you can go ahead and breathe. And I want to have you take a deep breath and hold it again, okay? Okay, I didn't hear any bruise, and that would indicate if you had some turbulent blood flow, but it sounds normal. So now I'm going to go ahead and listen to your lung sounds. So what I want to have you do is take nice deep breaths through your mouth as I move it over. Okay, I'm going to be listening to your bronchial sounds, your bronchial vesicular lung sounds, and then your vesicular lung sounds, excuse me. So I'm going to go ahead and do that now. Nice deep breaths through your mouth. Good. Good. I'm going to be listening on inspiration and expiration. Almost done. And then you get a little winded. Last time. Perfect. Now I'm going to actually listen to your lateral sense. So I'll just have you lift this arm up and go ahead and take a deep breath for me. Good. Good. Go ahead and put that down, and we'll listen to this side. Go ahead and take a deep breath. Good job, Kelly. All your breath sounds are very clear. They're equal bilaterally. Your chest expansion is also equal bilaterally. You don't appear to be in any distress. And your AP to T diameter is 1 to 2, which is normal. And so what I'll have you do is go ahead and flip around, and just so I can listen to your posterior lung sounds. So I'm first going to listen, and then I want you to take a deep breath and breathe through your mouth every time you feel my stethoscope. Okay, ready? Good, almost done. Very good. Okay, now I'm done listening, and your lung sounds back here sound very clear. I'm going to go ahead and check for any fremitus. So if you don't mind saying 99 every time you hear my hands, feel my hands.
99, 99, 99, 99, 99.
Perfect. Everything was even. I didn't feel any impeding airways there. And I'm going to go ahead and check for, I'm going to go ahead and percuss and check for reticence. Okay, everything has good renaissance. There is no dull sounds, so that is very good. And then what I'll have you do, Kelly, is I'll go ahead and have you lay down. And if you don't mind laying just on your elbows, just so you're at a 30 to 45 degree, and I'll just have you look that way, and I'm going to be checking for JVD, which is a sign of heart failure, especially right-sided heart failure, and I see it's negative on you. I don't see any vein distension. So that's good. You can go ahead and lay down to be more comfortable. And while you're laying down, I would also listen to your heart sounds, but we've already done that just for this exam. But I am going to go ahead and feel for your PMI, which is right at the apex of your heart, which is the fifth left midclavicular line, fifth intercostal space. So I'm just going to feel on you just so I can feel that space. Just counting your ribs here. Okay, I'm just going to lift up your bra here. Just kind of palpate. Perfect. It's nice and strong. And then if I had a hard time feeling that, I would lay you over to your left side. But we felt it great. So now I'm going to go ahead and check your pulses. I'm going to first do your radial pulses. They're nice and equally strong, about 3+. Do your brachial pulses. Okay, equal, strong. Okay, and then I'm going to check your skin integrity. It looks good. Your temperature is nice and warm and even throughout your body. I'm going to go ahead and check your cap refill. Got your nails nice and done. Very pretty. I'll check your nail bases. Okay, less than 3 seconds, which is normal. And then I'm going to go ahead and move down. So I'm going to check your femoral pulses. Sorry, it was a little hard to feel through there. That's okay. Okay. Nice and strong. I'm just going to, while we're here, we're just going to go ahead and palpate for lymph nodes. Okay, and then I'm going to move down to your popliteal pulses. I got to push a little hard. These are kind of harder to find. Okay, very good. Equal and strong. Your dorsalis pedis, which is the top of your foot. Okay, nice and strong. And then your posterior tibialis and the ankle. Okay, nice and strong too. Can you wiggle your toes? Good. Let me check for cap refill. Toes look nice and good here. Okay, less than 3 seconds. And then I'm going to check for any type of leg edema. I would check along the kind of the shin tibial bone. Okay. And then your temperature is very good, nice and warm and throughout. Kelly, we can go ahead and sit up and I can help you out.
Okay.
Perfect. Do you have any questions about today?
No, I don't.
Okay, you did great. Thank you so much.
Thank you.